The knee is a hinge joint that flexes and extends like a door opens and closes. The femur, or thigh bone, connects to the tibia, or shin bone. Ligaments hold the bones together, and muscles move the bones. Between the bones is the joint. There are two types of cartilage, meniscus and articular cartilage, that absorb shock, stabilize the joint, and enable smooth motion. The patella, or kneecap, sits on top of the knee where it connects with the femur, forming a small but important additional joint. There is thin articular cartilage between the patella and femur, but no meniscus. Lifelong daily use of the knees, combined with varying physical activity and occasional traumas, can cause permanent damage to the cartilage. There may be cartilage tearing, thinning, fraying, or tissue loss. This wear and tear is called degenerative joint disease, causing decreased space in the main joint or under the kneecap that can progress to bone on bone. In degenerative joint disease, the knee loses its smooth motion, and there may be painful catching or locking with certain activities. Also, because the damaged cartilage cannot absorb shock well, friction and stress can build up quickly in the knee with activity, leading to pain. When degenerative joint disease causes pain, it's called osteoarthritis.